Okay, so hi everybody, my name is Tawandra and I'm part of Naiad Labs and we're the team behind Medrowd. So right now, currently with the pandemic, the way it's going, we are at a critical time where healthcare can be really pushed into another realm. And so the area that we're focusing on is remote healthcare. And the problem that physicians are facing and patients themselves is that physicians don't really visit these areas as much because of one, it takes time and plus the areas are hard to reach. The residents themselves have to travel for further treatment and incurs costs, and that also affects families because at the end of the day they have to travel together and it costs build up. And there's also harsh weather conditions that can make travel really impossible at times, especially if there's snow or the roads are blocked. So our solution to this is to integrate, just one second, is a centralized integrated platform to receive personalized oversight by their health physicians. The system also helps with assessment, triaging, and monitoring of patients, and provides timely diagnostic testing and feedback by increasing access to physicians and specialists. So the reason why we tackled all three of these, because those are the main areas that we feel like that remote healthcare really needed a push in. So at the end of the day, Medrowd is a data analytics driven system for healthcare, and we're trying to leverage the technology that are available today in a way that actually minimizes overhead costs for the healthcare system in general. So currently we are working with four areas. So first of all, we are working with Christian communities, the Associate Clinic in Pincher Creek and Saddle Lake and Strathcona Hospital to understand the market a little bit better and to see what kind of traction we can build. So if you look further, our target market is remote patient monitoring and age tech. So that is why we picked these four, just to get a better idea of potentially what problems we would face and what we need to work on with Medrowd. And also we are picking these two markets to go further into because we feel like the capabilities of Medrowd fit better with these two markets. Currently, the size of the market, as everybody knows, there is a huge potential just because the way Canada is. A lot of our population is in rural areas compared to urban. And we are not really using the technologies that we have in front of us to the level that we potentially can. We do understand that we have a lot of direct competitors and indirect competitors in this space, but at the same time, we do know where our value is at. And we want to leverage those aspects in a way that actually can push us into the market a bit better. So one of the four, if there was four here, it would make more sense. But the four things that we are really focusing on is trying to understand how we can actually reduce our costs so we can give the client a better pricing. And I think that's one of the more important things for just to lower the barriers for customer adoption and to understand data-driven consumer learning as well. So at the end of the day, our goal for Medrowd is to create a digital healthcare ecosystem where we can connect the very aspects of the healthcare system in a centralized way where everybody knows where everything is at all times. None of the patients are falling through the cracks just because they're not in the centralized location where all the information is available. So we wanted to work with senior cares, pharmacies and clinics and First Nations to develop a system where everybody can get the information they need and the care they need in a more effective and at the same time reduce the overhead costs for the general healthcare system.
30 seconds.
Perfect. So this is our contact number and our email. So if you have any other questions, please feel to contact us and I will watch the chat just for any other issues. Thank you.